announced. This is Martin Giles of the Guildford Dragon News, and I am now with Louise Stead, who is the Chief Executive at the Royal Surrey County Hospital. Hi Louise, thank you for joining the Guildford Dragon.
Hi Martin, nice to see you again.
Okay, and we're still in the COVID pandemic, obviously, and unfortunately, we seem to be now in a third wave, and the infection rates are creeping up again in Surrey and across the country. Louise, how would you describe the current impact of the pandemic on the Royal Surrey Hospital at the moment? And can you give an average number of current inpatient cases you have and admissions per week?
Yes, so I think we are definitely seeing a slight increase. So we have been pretty steady over the last few weeks, between sort of 10 and 14 patients per week at the moment. All of those patients obviously are being cared for in our isolation ward at Guildford Ward, which we built during the first wave of the pandemic. So as I talked to you today, we have no patients in our intensive care unit. I think we continue to see a large number of patients coming to our emergency department. And also we are really focusing on trying to get through our backlog of surgery, which obviously was put on hold during the first pandemic. So we've got about a 44% reduction in our long waiters since April. So we're really focused on trying to get through those patients.
Okay, and perhaps we'll come back to that. But back onto the pandemic, those that are being admitted to hospital. Now, from the national statistics, I'm getting that there's been about, they're a bit dated, but about 8 per week. But you're saying it's actually more than that per week.
Well, we've got, at any one point, we've got between about 10 and 14 in the trust. But of course, some might be there for longer than a week. So I can't give you how many are being admitted a week, Martin, I'm afraid.
Oh, fair enough. Well, I understand. So that could be correct, the national statistic.
Yes.
But what you're saying is on average is about 14 inpatients per week at any one time. Okay, that's
right,
good.
Yeah.
And are those that are being admitted, are they mainly those that have not been vaccinated and therefore younger patients?
So they are definitely younger. So during the first, second wave, the average age was about 68, 70. We're now seeing the average age is about 48. So although we obviously ask if patients have been vaccinated, we're not nationally required to report that information. So I can't tell you whether they've been vaccinated or not. But you could extrapolate that assumption, couldn't you, by the fact that the age range is lower.
Yeah, so it does appear that the vaccination program has been successful.
Yes,
and I guess you'd be recommending that everyone gets vaccinated as soon as they can.
Absolutely. I think that we've really seen a great increase. If you think about the number of patients that were in ITU during the previous waves, and I've just said we currently don't have anyone in ITU, and we haven't so far through this third wave. That shows you, I think, that even the people who have been vaccinated and are getting COVID, they are less ill with it.
Well, that's good to hear.
Really important.
And has one of the factors in that been that the effect that you've developed more effective treatments that have led to these better outcomes and fewer deaths?
Absolutely. I mean, I think we're learning all the time about new treatments, new drug treatments, also the fact that we're using different types of oxygen therapy. So yeah, I mean, every day there's something, isn't there, in the news about a new treatment that's being licensed or suggested. And I think the whole country is learning. And I think particularly intensive care has put a lot of focus on the first waves and how they could learn and look after these patients. So yes, I think that's a really positive move.
Okay, now, if my memory is correct, in your recent interview with the BBC, you said your major concern now is the backlog of non-COVID cases. Is that right?
Yes, I mean, I think we've got people who we know have been waiting far too long for surgery. Since April, we have reduced our long waiting patients by 44%. So it is, I mean, obviously people were put on waiting lists because they needed some sort of intervention. So we don't want people to have to wait longer than they have to for that. And I think one of the issues we have at the moment is that not everybody we invite to come in for a procedure or an operation is willing to come in. So that obviously creates us more of a problem. So, you know, if I ask you today and you say no, I have to go back and find somebody else suitable for the slot. So either the slot goes empty or the admin staff are spending a lot of time trying to find someone else that is suitable for that.
So your advice is if they are called forward to come forward?
Absolutely, if they can, that will really help us get through the numbers.
Okay, and is also part of that people with worries should see their GP to make sure that things are addressed?
Yeah, I mean, I think in the same way, if you're worried about coming in for surgery, you know.
No, sorry, I meant if they're worried about symptoms they're experiencing.
Oh, sorry, absolutely. GP or 111. I think there's some or pharmacists. You know, there's a lot of really good advice out there, as well as coming to A&E if you think it's something that is life-threatening, obviously.
So they shouldn't put up with it just because of the background of the pandemic?
No, absolutely not, because you know all the health services are open for people now, and we just need to make sure that people go to the most appropriate one for them.
Yes. Okay, good. Now, how is staff morale standing up? The pandemic's been going on for so long now. Is there any sort of weariness with it, or what's happening?
Well, I mean, there absolutely is weariness. I think it's been a really long haul, hasn't it? You know, not just for healthcare staff, but for you know the whole country. I think that staff have done what they do very well at the Royal Surrey, which is they support each other and they really try and build their teams around that. We've really had a big focus on it as a trust. So all our divisions have sort of health and well-being targets. We've employed some extra psychologists. We've really tried to listen to what people say and really see what we can support around their mental health. And we have sort of drop-in sessions for around mental health or psychology. We've been really lucky with the support we've had from the Royal Surrey charity and also the local public. And we've managed to build what we're calling a well-being cabin, which will be a dedicated space to do things like yoga or staff support offerings. So there is somewhere for staff to go that takes them out of their work environment.
Right.
So we're really trying to focus as hard as we can on that.
Okay, well, I do hope that, I mean, obviously the pandemic has almost become our normal situation now. And but I do hope that the staff do realize, I know from the comments we have had during the pandemic, that their efforts are appreciated. And it's very easy for us to take the NHS for granted in the best of times, but you know, I don't think everyone does. I think we are all really pleased when we think about it that it's there and you're supporting us all. So thank you.
No, thank you very much. And I think we really do feel the support the community have given us.
Okay, Louise Stead, you're a busy lady. I'll let you get back to work. Thank you very much.
Thank you, Martin.